everyone, happy morning, a very good morning. I welcome you all to today's YouTube live session, Sunday morning. Glad to see you all here, and yes, glad to be here as well Sunday morning with this session. So today is going to be a productive Sunday because we have this one session and we have the next session also today at 11 a.m. So whoever wants to watch the match today evening, you'll be free to do that from my end. So I'm finishing off the sessions in the first half itself. So whoever wants to watch the match today evening, you'll be free to do that from my end. So I'm finishing off the session. Right. Okay. I hope I'm audible and visible to everyone. Yes, so we have the next session at 11 a.m. but it's on the app, the Unacademy app. If you don't have that, you need to download that. And when you are attending the class, if asked for a unlock code, you can use the code Dr Nikita Live or Dr Nikita to watch the free live classes or even to take a subscription, right? So we are going to have KBMD, that is Kaun Banega MD, which is basically a live quiz with leaderboard for biochemistry. Since all of you have finished biochemistry recently based on the daily targets, so we'll have biochemistry for today. Let me tell you the plan for tomorrow. Tomorrow what we are going to have is again like this 8:15 a.m. sessions are going to be there almost on daily basis. So tomorrow we will have a quick review the next NF100 episode. This is episode 14, so episode 15. Very important, larynx ka anatomy. You get quite a few questions on that, the cartilages and the muscles of larynx. So that is what we are going to have. Dr. Ravi, I'll provide the PDF, though I am not sure whether I have with annotations. If I have, I'll definitely share with annotations, or without annotations, so definitely I'll share on Telegram group. Okay, so tomorrow 8:15 a.m. Larynx anatomy, and we will have 5 p.m. So this is how the plan is going to be: 8:15 a.m. on YouTube like for the next week, and 5 p.m. on the app. It's gonna be on the special class. Okay, and since we are starting with hematology in the daily targets tomorrow, so we will be starting with the hematology sessions on the app. Okay, so tomorrow it's gonna be hemat at 5 p.m. and larynx anatomy 8:15 a.m. all right, and plus subscribers and the iconic subscribers. If you don't know what's iconic, it is Unacademy with Prep Ladder. You get the best of both the platforms in one subscription, which I think is more cost effective. Special class has a lot of features similar to the plus classes. It is interactive live classes. You have the polls based on which we have the live quizzes. The subscribers can use raise a hand feature to talk to the educator, and even like after the class you get the PDF available. Question bank is something which has been updated. Please make the best of it. And today you have test as well. So 24th October today 2 to 5 p.m. you have INI-CT mock test 200 questions. Make sure you give that. And the FMG students can give the test next Sunday on 31st. Alright. And the new batches starting on 27th of October for 2022 students, a 6 months course. And for final year students also on 27th, where we discuss the clinical cases and the instruments. Alright. So let's start with this first pre-session assessment question. Dr. Ravi, I have not shared it. I'll share it, as I said. I'll share the PDF of the today afternoon. I'll do that. And if this live stream goes off air suddenly, please join back on the link. It might go off air, like in the majority of the sessions we are seeing. Let's start with this assessment question. What do you think is the answer here? What is the diagnosis? No options here. Amazing. So Vivek, I see answering a lot of questions. Yes, very good, Sarita. This is Fredericks ataxia. So you have a 23-year-old male with a medical history of diabetes mellitus, now having muscle weakness, staggering gait, frequent fall, dysarthria, curvature in the spine. There is muscle weakness, loss of deep tendon reflexes. There is nystagmus, pescevus, kyphoscoliosis. Had a recent visit for pneumonia, and there is hypertrophic cardiomyopathy. All this are very, very important features that tell you that this is Fredericks ataxia, okay, which comes under the spectrum of trinucleotide repeat disorders. I'll discuss this again. This was just a pre-test pre-session assessment. Okay, now this is a table from your reference books, Robbins, जहाँ दिया गया है trinucleotide repeat disorders. For FMGE exam, we need to know the most important ones. For the rest, NEET PG, NICT, we need to know everything. So let's focus on the most important. Now look at the trinucleotide repeat. It could be CGG, GAA, CTG. Majority of them is CAG. Okay, the majority of them is CAG. Now remember, the CAG is the one which is expansion affecting the coding regions. Okay, this is affecting the coding region. So CAG is basically your coding region, and in CAG we have Huntington's disease. Okay, we have Huntington's disease. The rest of the three which are very important for FMG exam, you should know these four. Fragile X, CGG, Fredericks ataxia, GAA is repeated, and myotonic dystrophy, CTG is repeated. So basically in trinucleotide repeat disorders, what happens is trinucleotide, right, your CAG, 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 this is repeated multiple number of times. Let's say if normal number is 5, this will be repeated by 30 times, 50 times and all of that. Okay, so that is a trinucleotide repeat disorder. Now out of the four most important ones, the one which affects the coding region is the Huntington's disease. Okay, that is the coding region which is the Huntington's disease. So how do you remember the trinucleotide repeats which are repeated? Remember, generally the C and G, the first place and the last place here, they are the same in majority of them. So you have CG, so you have CG, the first and the last. Beach mein there comes CAG, CTG or CGG. Okay, that is what comes in between. A, T and G, that is what comes in between. So CAG is your Huntington's disease. Okay, that is Huntington's. How do we remember this is Huntington's, imagine like a hunter. Okay, hunter hunting an animal and putting into the cage. Okay, putting into the cage. So that is CAG. Okay, hunter and cage. What is the chromosome number? Since we are here, let's discuss that as well. What is the chromosome number for Huntington's disease? Chromosome 4. Absolutely right, Anisha. So remember that cage has 4 walls, right? The cage has 4 walls. So that is your chromosome number 4. And what is the inheritance pattern of Huntington's disease? Inheritance pattern, remember it is autosomal dominant. Remember, hunter is a dominant personality. Hunters are dominants. So remember it is autosomal dominant, cage, CAG, and it's chromosome number 4. Okay, it's chromosome number 4. What is the manifestations, the clinical presentation in Huntington's disease? Remember the 3 M's for Huntington's disease. What are the 3 M's? It is Huntington's chorea. Chorea matlab your movement disorder. Movement, memory, there is dementia, and mood, there are behavior abnormalities. So movement, memory and mood are affected in Huntington's. Okay, that is the 3M, movement, memory and mood. Okay, now CTG, whether it's Fragile X, it's Fredericks ataxia, or it is your myotonic dystrophy. So remember, CTG is your myotonic dystrophy. Okay, CTG is myotonic dystrophy. The T, myotonic mein, the T helps you to remember, that is your myotonic. Like in Fragile X, there is no T in the spelling. In Fredericks, you have no T in Fredericks. So myotonic dystrophy, TT in both the words, that is your CTG. And CGG is your Fragile X. Okay, remember CGG, it has G in the middle, like in myotonic, T is in between. In Fragile X, G is in between. So that is your CGG. Yes, myotonic dystrophy, again, myotonic dystrophy, autosomal dominant, chromosome number 19, asked in one of the NEET PG exams. It is your Yes, it is your chromosome number 19, autosomal dominant. Okay. So remember, myotonic fragile X, and it is Huntington's is cage. What remains is your Fredericks ataxia. Okay, Fredericks ataxia. Imagine Frederick, who's a singer. Okay, Frederick is a singer who sings, that is Ga. Okay, Ga. So the trinucleotide repeat in Frederick singer Ga is GAA. Okay, that is GAA. And what is the chromosome number for Fredericks ataxia? It is chromosome number 9. Okay, it's chromosome number 9. It is autosomal recessive. Okay, it is autosomal recessive. And if I ask you which of these disorders is X-linked, which of these is X-linked? Of course, fragile X. When you say X, it tells you it's located to the X chromosome. It is a X-linked. Autosomal recessive, Fredericks ataxia. Huntington's and myotonic, these are your autosomal dominant. Okay, these are autosomal dominant. So let's complete this table here. Huntington's is cage. So that is CAG. Okay, that is CAG. Fragile X, G is CGG. Myotonic dystrophy is CTG. And Frederick Ga is your GAA. Okay, Fredericks ataxia is GAA. Okay, that is GAA. Huntington's autosomal dominant, this is X-linked. Myotonic autosomal dominant. Fredericks ataxia is autosomal recessive. Okay, that is autosomal recessive. Huntington's is chromosome number 4. This is chromosome X, chromosome 19, and this is chromosome 9. Okay, this is chromosome 9. Now let us have a look at some flashcards, the clinical presentation. So they'll give you a clinical scenario and they'll ask you what is the trinucleotide repeat in this condition. So you need to know some key words that will help you make a diagnosis. Movement, memory, mood, जैसे हमने बोला, is what? Movement, memory and mood changes. That would be Huntington's, right? That would be Huntington's. Just a minute. Yes, so this is going to be Huntington's chorea or Huntington's disease, where there is chorea, dementia and the behavior abnormalities. What is this? Mental retardation, large ears, large jaws and macroorchidism. Large testes. Yes, remember this is fragile X. Okay, this is fragile X. You can remember this. Everything is large in fragile X. When you make something very large, you stretch, like ears, if you are stretching, they might break. Okay, so they are fragile. So remember, if anything is too big, it is stretched a lot, it can break. So remember, fragile means too big. Everything is big. So large ears, large jaws, large testes, all these are features of fragile X. And fragile X is a very, very important common cause of mental retardation. Okay, so mental retardation is seen. And what is the protein affected in fragile X? It is fragile mental retardation. You can remember like that. It is your FMR1 protein which is affected. It is FMR. Okay, it's FMR. Next one, loss of motor control, dementia and affective disorder. Which one is this? Loss of motor control, dementia and affective disorder. Which one is this? So everybody just got trapped. If I've asked you one Huntington's, does not mean that I cannot use another Huntington's ka flashcard. Motor control, movement, dementia, memory, affective disorder means mood, right? So it is basically the same triad of movement, memory and the mood which is affected. So this is Huntington's again. So do not have those bias, the pre-bias ki Huntington's वापस नहीं आ सकता है. In myotonic, I'll tell you the other flashcard which is coming. So this is Huntington's again. Okay, this is Huntington's. That is how it happens. Even in the examination, you can get multiple questions on same topic. So do not think कि एक question vitamin B12 पे आ गया है, तो दूसरा question cannot be there. So remember, this is Huntington's again. Right. Next one. What do you think is this now? Muscle loss, cardiac arrhythmia, cataract and frontal baldness. Classical history here, there is cardiac arrhythmia. Okay, there is cardiac arrhythmia. Cataract is there and frontal baldness. This is very, very important. Yes, now all these are features of myotonic dystrophy. Okay, this is myotonic dystrophy. Myotonic, so there is tonia of the muscle, right? So problem in holding the things, muscle mein problem hai, and muscle loss. It can affect the cardiac muscle also. So there can be arrhythmia, there can be AV blocks, conduction problems, all can be there. Cataract, absolutely right. So already answered what type of cataract we get. Christmas tree cataract, right? Very, very important. We get Christmas tree cataract in myotonic. So remember myotonic T again, it is your tree wala cataract, okay, Christmas tree. And frontal baldness is seen. Very, very important clue for myotonic dystrophy. What will be the trinucleotide repeat here? Myotonic is T. It is CTG, chromosome 19, autosomal dominant. Okay, chromosome 19, autosomal dominant. Very, very important. So in myotonic dystrophy, you'll get the history of ptosis as well. Okay, the facial muscles, proximal muscles, those are affected. There will be ptosis as well. Next one, which one is this? Very, very important. Frequent falls, dysarthria, speech mein problem, skeletal, there is scoliosis, foot deformity like hammer toe, pes cavus can be there. This is very, very important for Fredericks ataxia. The deep tendon reflexes are absent, but the Babinski's is extensor. Right, so you have contradictory findings here. The deep tendon reflexes are absent, but the Babinski's is extensor, and HOCM is the most common cause of death. Okay, the hypertrophic cardiomyopathy. All these are features of Fredericks ataxia. Okay, these are the features of Fredericks ataxia. So remember F for Fredericks, it has frequent falls, it has foot deformities. So pes cavus, hammer toes. And remember ending in H, it is associated with HOCM. Okay, it is associated with HOCM. Remember D for diabetes mellitus. Okay, D for diabetes mellitus. What is I here? I, remember there is excess iron accumulation. It's basically a mitochondrial dysfunction. There is excessive iron accumulation causing damage to the neurons. So that causes oxidative stress. That is Fredericks ataxia. So when you have history of diabetes, HOCM, ataxia, dysarthria, this is very, very classical of Fredericks ataxia. At what age the patient presents? Does it present in the childhood, in the elderly, in the neonate? At what age the patient presents? Remember, it's always like less than 20 years of age the patient should present. Not after that. Okay, so within 20-25 years the patient should present. And important findings on examination, nystagmus can be there, and also Babinski's extensor, but the deep tendon reflexes are absent. You have GA repeat, this is chromosome number 9, this is autosomal recessive. Very, very important. Okay, now let us see some images. Now image based questions on trinucleotide repeat disorders. What do you think, which is this one? Which trinucleotide repeat disorder are we showing here? So look at the kyphosis, look at the scoliosis, and look at the hammer toe. So basically where you have kyphoscoliosis, right, there's kyphoscoliosis, there is hammer toe is what we are seeing. Again, this is Fredericks ataxia. What is the trinucleotide repeat? GA. Frederick is a singer, GA. Okay, that is GA. Next one, in Fredericks ataxia, remember these points which we discussed already. The essential criteria: onset before 25, it is ataxia. The deep tendon reflexes are absent, and there is dysarthria as well. Additional findings: scoliosis. There can be your ECG abnormality, nystagmus is there, pes cavus, and diabetes. Okay, all these are the very, very important features of Fredericks. What do you think is this trinucleotide repeat disorder? Which one is this? Very good, Sarita. Absolutely right. Yes, Dr. Manaswini, this is myotonic dystrophy. Why is this myotonic dystrophy? Why is this myotonic dystrophy? Because of this Christmas tree cataract that we are seeing here. So we have the Christmas tree cataract. Tree tells you this is myotonic. The repeat is CTG. Chromosome number 19. It is autosomal dominant. What are the other features? It can cause cardiac arrhythmias, AV blocks, ptosis, facial muscle weakness, and frontal baldness. Okay, and frontal baldness. All these are very, very important features of myotonic dystrophy. Okay, and what do you think is the diagnosis here in this case? Yes, so what is this? This is a MRI image. Why do I call it MRI? Because we can see the black bone here. Okay, surrounding the brain, you can see the black bone. This is MRI. What sequence of MRI is this? Anyone? What sequence of MRI is this? T1, T2, flare. What is this? This is a T1 weighted MRI. Why? Because T1, first year subject, anatomy, like anatomy, white matter is white. You can see this white matter is white here. All this is the white matter. Bahar wala is the gray matter. Yes, very good. So this is your T1 weighted MRI. This is showing the prominent frontal horns of the lateral ventricles. These are the ventricles. So you see the prominent frontal horns. Why are the frontal horns prominent? Anatomically, what do we see adjacent to the frontal horns? We see the caudate head. So in Huntington's disease, there is caudate atrophy. Right, easy to remember. Huntington's is chorea. That is C for C. Chorea is seen with caudate problem. So when there is caudate atrophy, the frontal horns get space to dilate now. They are not getting compressed. So the frontal horns will dilate. So that you see the prominent frontal horns. And this is called as boxcar ventricle. Okay, the boxcar appearance of the lateral ventricle is when you have the dilated frontal horns, the prominent frontal horns. Okay, so boxcar ventricle, this is a feature of Huntington's disease, right? The trinucleotide repeat CAG, chromosome number 4, it is autosomal dominant. Okay, it is autosomal dominant. So remember, the boxcar ventricles, very, very important, seen in Huntington's due to caudate atrophy. What are we seeing here? What are we seeing in this image? Now you have an extra edge question, guys. You need to tell me in the comments, especially the NEET PG INICT students, which is that trinucleotide repeat disorder which can present with androgen insensitivity. Okay, let me know in the comments after the live chat which is that one which has androgen insensitivity. Right, this is Fragile X because you can see the large ears here which can break, stretch too much. So Fragile X is CGG, right? It is CGG X-linked disorder. So this is Fragile X. Okay, what do you think is the diagnosis in this case? A very, very lengthy question. Let's see how many of you can make a diagnosis here. "35-year-old woman presents because of visual problems. She always had difficulty looking up and vision has become blurry, and there is episodes of near fainting, no medication, no other medical history, not seen a physician for 7 years. Because she was adopted as a child, does not know the family history, but her son has required special tutoring at school. The patient also remarks that her son seems to have been dropping objects lately. Physical examination, there is ptosis, extraocular muscles normal, pupils equal, vision is this much, and when you check for the lower limbs, she raises her knees and makes a slapping sound on the floor as she walks, and there is heart block. What do you think is the diagnosis? Very good, Deepak. So the today's timetable, we have 11 o'clock biochemistry live quiz. Otherwise, daily we will have a class at 8:15, your FMGE Top 100 topics, and at 5 p.m. we will have a special class on the app. Okay. Yes, so you guys are super awesome. Yes, the correct answer here is this is myotonic dystrophy. All the features here that the patient has ptosis and ptosis, not able to look up, that is ptosis. Examination pe bhi hai. Even the son is affected. Parent affected, let's say at the age of 40, son affected at early age. What is this called as in trinucleotide repeat disorder? Successive generations affected at early age. This phenomenon is called as anticipation. Okay, remember this is called as anticipation. So you can anticipate ki next generation mein jaldi hoga. Remember this is anticipation. And even the history of heart block is there. Cardiac arrhythmias, cardiac blocks, all these tells you this is myotonic dystrophy. This is trinucleotide repeat expansion. Borrelia burgdorferi infection, it causes Lyme's disease. Yes, it can cause the heart block, but it will not have the rest of the muscular problems. It has your rash, the erythema जो हमारा target जैसा होता है rash, and it has nerve palsies, it has facial nerve palsy. All those are features of Lyme disease. The cardiac block comes very soon. Dystrophin, emirin, these are your other muscular dystrophies. They will have proximal muscle weakness, right? They will not have ptosis and all. So the diagnosis here is your myotonic dystrophy. Okay, that is myotonic dystrophy. So yes, that was about the today's session. As I said, let me know in the comments which is the trinucleotide repeat disorder which presents with androgen insensitivity. Not important for FMG, but for NEET PG and INICET. This is an extra edge question. Do let me know in the comments. Okay, which is the one which can have androgen insensitivity, and what is the trinucleotide repeat in that case. Okay, what is the trinucleotide repeat? Okay, so see you all guys at 11 a.m. with the quiz on biochemistry. Very interesting, very conceptual questions. Majority of the expected questions that are asked in your exam. Okay, so see you at 11. The answer is not myotonic dystrophy. Integrated class, the plan for today is only to have biochemistry. Okay, so and you'll be free for the rest of the day from my side. Okay, so goodbye everyone. Thank you so much for joining in and hearing me out, and keep studying, keep revising, and keep winning.